If a patient feels they are being discriminated against due to race or any other reasons, what options do they have, steps should they take to rectify the situation?
RISE recently held a State of the Black Community Forum. It was entitled Health Conversations from Real Life Experiences. Carolyn McGuffin told a shocking story about taking blood pressure medicine for years unnecessarily.
He left me on it, and when I was working, I kept going to the dispensary getting my blood pressure checked, and the nurse kept saying to me, she said, Carol, she said, why are you on blood pressure medicine? She said, your blood pressure is so low, you don't need blood pressure medicine. So I went back and told him, and I said, the nurse says, he says, well, and this is the excuse he gave me, like we always hear, you gotta remember one thing, you're black, black people have high blood pressure.
Wow.
Most of the time, and he said, and listen, he said, once you get on it, he said you should stay on it. Wow. He said, because if I take you off of it, you have a heart attack or stroke, then you're gonna blame me for it today. So I did. I stayed on it, and that is what the doctors in Charlottesville chalked it up to. That's what it was.
As sad as McGuffin's story is, she's not alone. She gave advice to those who are having similar situations.
Always get a second opinion, number one, you know. Just because that we're black doesn't mean that we just have to take any kind of medicine.
RISE co-founder Sharon Fitz served as moderator for the event. Fitz explained the purpose of the health forum.
Because of that, many black people struggle with trust when they go into the doctor's office, and so we're trying to do something to stop that. We're trying to actually figure out how to address that issue, because it is an issue, but it's not one that's being discussed or even addressed.
Veronica Salisbury Bell is a registered nurse. She told how her husband was misunderstood at the hospital when he needed pain medication.
You can't say that it's not still being done in the hospital.
Right.
It's still being done today. You know, and I'm going to elaborate on my husband. You know, he has chronic back pain. You know, he was on a certain amount, and all of a sudden they just started decreasing it. Why are you decreasing it? His pain hasn't improved. But because he's a black African American male, they decided that he was drug seeking, and they were going to lower his medicine. But me and some people got together, and we sort of fought that, and his pain's now he's been able to manage his pain.
She agrees with McGuffin about asking for a second opinion if the patient is concerned the doctor's diagnosis is wrong.
That you have to advocate for yourself. You need to know your symptoms, you need to know your body. You need to say, this is what's going on. If they fail to treat you, then you need to go ahead and get a second opinion.
Dr. Sam Hostetter is a medical physician. He explained doctors being reprimanded by hospitals is not as easy as it sounds.
That's always one of those dangers of an internal review, is how internal is it? And are they really independent enough to do what needs to be done, or are they going to be listening to somebody that says, you know, try to take care of that in a quiet way?
Dr. Hostetter says building trust with your doctor is imperative for patients.
Because I think it is an important conversation to find ways to help people build trust in their physician, because if you don't trust your physician, you're not getting anywhere. And that's got to be an important part for both the patient, but then also makes my job a whole lot easier if people can tell me what's really going on.
Pamela Salisbury Smith is also a registered nurse. She told the crowd methamphetamines are crossing the borderlines of race and age.
Methamphetamine abuse, it is a Schedule II drug. It's a stimulant drug. It's highly addictive. It's a white, bitter tasting. It's used in pill form. It can be ingested. It can be snorted. It can be shot up. It destroys families, whole families, starting with your grandparents, the parents, the kids. There are a lot of children in foster care because of the meth epidemic.
Joy Ingram is a RISE Wellness team member.
Pam's talk about meth and the fact that it's not just a white issue, it's a black issue, it's an everyone issue.
AJ Young is the RISE Wellness Advocacy team manager.
You know, when I learned about the experiments that were done by doctors years ago on black women, it really just reinforced some things that I had learned earlier, as I said tonight, about the University of Virginia, and experiments that went under the radar, so to speak, concerning so many people of color. And not only just people of color, but those folks who are disadvantaged, who considered underclass, who have intellectual disabilities, how those people were sterilized without their knowledge, without their consent, because they were deemed to be not fit for the advancement of society. That really just confirmed so many things for me, that we as a people need to be educated about what exactly doctors are diagnosing us with. Why are they diagnosing us with this? We need to be asking questions. We need to be in forums like we had tonight that will encourage us to seek out patient advocates.
In Waynesboro, Elaine Rackley for Breaking Through News.